Hi, I'm Dr. Leonard Karadimas. I'm an orthopedic surgeon at Advanced Orthopedics in Port Huron, Michigan, and I'm here today to talk to you about anterior hip replacement surgery, direct anterior hip replacement surgery. Traditionally, hip surgery was performed by incisions through the outside of the hip or the back of the hip. The more modern way to do it is from the front side of the hip. You can do it through a 4-inch incision. You don't cut any muscle or tendon. So it's tissue sparing. Certainly it allows us to get in and out of the hip without causing any damage or less damage. Hospital stays are shorter, recovery is a lot quicker. One of the most important things though with a direct anterior hip replacement, I certainly have a hip replacement right here to show you, is our ability to actually see the components go in during the surgery. Traditionally, what we would do is perform the surgery, and this is still being done right now, perform the surgery, put the components in, so you basically clean out the worn out socket, put a new socket in, remove the worn out ball, and put a stem down the shaft with a ball on there, and that's your new hip. What we would do is do this hip replacement, put the components in, kind of eyeball it, and we were pretty good at doing that, and then close it all up, and get an x-ray in the recovery room to see where we were at. And certainly things weren't always perfect, but they were usually pretty close. The great thing about performing a direct anterior hip replacement surgery is the use of the table. The table is called the Hanna table. And the Hanna table allows us to put the patient in the right position for this direct anterior hip replacement. But one of the most important things it does is allows me to look at the actual implants as I'm putting them in. And the most important part of this is actually going to be the cup. Because if the cup is not in the perfect spot, you can have residual pain, you can have increased wear, decreased range of motion. So the great thing about doing the direct anterior hip replacement with the table is that during the surgery, I use a C-arm fluoroscopy, which is a live x-ray, and actually watch that cup go in. And I make sure that that cup is in a perfect spot when I put it in when we have the patient open on the table. You get the components exactly where you want them, so you're not worried about being off by a little bit. And having the components exactly where you want them in the perfect spot is actually the most important part of the whole procedure. And the analogy that I give people is this. Imagine for a moment that I have the best tire money can buy, and I put it on your car, but I put it on a little crooked. So when you're driving your car, it wobbles a little bit, but not much. It's okay. What's going to happen to that super expensive best tire you can buy? It's going to wear out quicker. Now let's imagine we have a mediocre tire, a middle of the road tire, and I put it on your car perfectly. What's going to happen? Your car is going to drive fine, and that tire is going to last a lot longer than the other one that wobbles. So if you're thinking about a hip replacement, you certainly want to consider direct anterior hip with the table. My name is Dr. Leonard Karadimas. I'm an orthopedic surgeon in Port Huron, Michigan. Thank you.